Hi, this is Dr. Kurt Wooler for autismrecoverysystem.com. Let's talk about the differences between the urinary peptide versus the food IgG test, but also really the differences between what information is obtained from these tests and what that means for an individual with autism. So this is just the first page of the food IgG sensitivity test from Great Plains Laboratory. And I really like Great Plains test because it's a comprehensive food sensitivity profile. What it does is it breaks things down into mild, moderate, and high reactivity on foods. So generally when I'm looking at doing some type of food avoidance as much as possible is anything that's in that peach to orange section, so to speak, here in what you're seeing. Now, the other nice thing about this test is it's a dried blood spot, which means it can be done at home. So it's a finger prick test that's relatively easy to do. I never want to indicate that any test is easy to do for a child, but from a blood testing standpoint, it's much easier to do this test than a blood draw. Now, it's important to understand the distinction between IgG and IgE. Allergists, or those who are assessing for true allergy, would be looking at IgE. IgE is what releases histamine. It's what causes that typical allergic reaction. So sneezing or coughing or skin rashes, for example, after a certain type of food, or an insect bite, for example, would be an IgE mediated event. The problem is that most people don't have severe IgE allergies, including many kids with autism. What most people have, when they have a reactivity to a food from an immune system standpoint, is an IgG reaction, which is more delayed. It's not as serious or severe. You're not going to get an anaphylactic reaction, for example. You can typically get some digestive problems that might be gas or bloating or loose stools. Other people get joint aches and pains. Other people get headaches. Some of that's hard to sometimes ascertain for a child with autism, but it's more of a delayed onset. Now, Great Plains also has the urinary peptide test. And this is where it looks at the casomorphine and the gliadorphine from milk and wheat, respectively, to see if they're elevated. In this particular case, we see that it's high in this particular child. So peptides are not linked to the immune system. They're not triggering an inflammatory reaction like IgE or IgE. I should say they're not triggering an immune reaction, but they can have a chemical effect. And what ends up happening is these proteins from these foods cross through the digestive system and can cross over the blood-brain barrier and then interact with opiate receptors in the brain. And that can trigger behavioral problems, language problems, eye contact, sleep issues, sensory problems, self-stimulatory behavior. There's a host of things that these reactions can cause. And in severe cases, there are kids who become really addicted to dairy and gluten foods, not because of the immune system being involved, but because the food protein is acting like an opiate drug. Now, this is the same food sensitivity profile on the same child. This was just a child out of China. And so here we see the dairy is normal under the IgG, and the wheat and gluten are normal under the IgG immune reaction component. But if you were to go back and remember, the urinary peptide test was very elevated for both. So this is a child that has a gluten and dairy peptide sensitivity, but not an IgG immune sensitivity. So they don't really have an immune gluten intolerance, but they definitely have the opiate drug-like effect. The bottom line is that the needs to be tried. And so we know that when we can remove gluten and casein from a child like this, a lot of times there can be improvements in bowel function, certainly constipation, sometimes diarrhea. But a lot of times what we see is an improvement in emotional instability, an improvement in self-stimulatory behavior, focusing, attention. So in this particular case, you might actually see more on the cognitive side of the equation versus, let's say, physical changes from a bowel standpoint or bloating or gas. Now, I generally recommend an implementation of the gluten casein-free diet for at least 3 months, minimally 3 months. If we can go longer than that, great, but you should see some type of discernible change with your child in that 3-month period of time. And honestly, you'll see it a lot sooner than that, sometimes within the first few weeks. Now, dairy is usually a little bit easier to recognize in food and labeling than sometimes gluten. So I recommend starting with the dairy removal first for about the first 2-3 weeks. And then at the same time, you're working at identifying gluten foods and moving into the gluten food aspect as well. There is nothing like trying the gluten casein-free diet to see if it works. I have had cases where even the tests were inconclusive, but the child still responded positively to the removal of gluten and dairy. So I think it's just a good overall thing to try. One other thing to remember about this type of intervention is, on average, and this is just within my practice, but about 70% of the kids tend to be more dairy reactive than they are gluten reactive. So there's a higher chance of seeing positive changes from the get-go just with dairy removal than gluten. I don't want to undersell the importance of gluten, but usually it's on the dairy end. But it seems to be those kids who are really gluten reactive are really strongly gluten reactive. So it's still an important component. Generally, at the end of that 3-month period of time, you can really assess and say, okay, what have we seen? What has changed? And the percentages work in our favors. Greater than 85%, probably even higher than that, of children, teenagers, and adults too, with on the autism spectrum will have some positive change with a gluten casein-free diet. So in my experience, it's a worthwhile thing to pursue. Now, these labs, whether it's the urinary peptide test or the food IgG dried blood spot, can be obtained directly from the lab as well as from this website here, labtestsplus.com. When labs are ordered through this website, they come to us. There's a personalized written interpretation based on the findings with some action step suggestions that go along with that as well. I'm Dr. Kurt Wohler for AutismRecoverySystem.com. Thank you.